Today's topic is informed consent. Following the Nuremberg trials, informed consent became the cornerstone principle within research ethics. Today, it's well understood that research with human beings should not be conducted without their voluntary informed consent. And this is an area where our regulations are clear. They stipulate the kinds of information that researchers should convey to participants and the obligation to avoid coercing their participation. But Jean, as is often the case, we fall short of the ethical and the regulatory ideal.
Yes, I think the difficulties in informed consent process are well documented. Often investigators really resist a thoroughgoing informed consent process because they believe it'll discourage participation in a research project. They also think that it creates misunderstanding and can interfere with randomization. In one study, Applebaum and Roth found that of 17 investigators that they surveyed who worked with study participants, only half believed in the importance of informed consent as an ethical principle. And the others rejected it as an unattainable intrusion on the conduct of research.
And Jean, this just underscores the need for education in this area. Our interview today is with Dr. Jerry Kuchar. Dr. Kuchar is the editor of the journal Ethics and Behavior and a co-author of the book Ethics in Psychology. I began our interview by asking Dr. Kuchar about the history of informed consent.
Well, Jim, we could probably go back to basic fundamentals of human strivings for autonomy. We would probably also have to spend some time looking at the idea of respect for persons. The two are very much intertwined. In the 20th century, before we really began to regulate the process of informed consent in research, a lot of us were influenced by the Nuremberg Code. That is a document that was produced after the end of World War II with the discovery of so-called medical experiments by Nazi doctors, where the participants really had no say in what was happening to them.
And in the Nuremberg Code, the principle of informed consent was the very first of 10 principles, giving it a priority of sorts. And then we see later that as the United States began to develop rules and guidelines for the conduct of research and drafted the Belmont Report, also we find the principle of informed consent appearing under this notion that you mentioned, the notion of respect for persons. We often hear it said that the concept of autonomy is a Western construct, that it simply doesn't exist in other cultures. And that's part of why I like the idea of respect for persons. Do you think that that's a universal idea and that it can be applied to research in cultures outside of the West?
I think it really is important to consider the differences of the culture one is working with or within. In particular, I think of Asian cultures where, unlike Western cultures, autonomy is less prized as a value and social integration is more prized. In particular, I think about Japanese culture where patients in medical settings are often not openly in dialogue about their illness. In fact, with some Japanese families, it might be considered inappropriate to discuss a patient's medical illness with them. In such circumstances, getting informed consent would be difficult. Out of respect for the culture, there would probably have to be some modifications of involving family members rather than involving the person directly. I guess the bottom line answer to your question is that I would always hope that in getting consent to participate in research, we would be respectful of the culture of origin of the people we're dealing with.
I think that would be true not only in international research, but also in research in the United States, which is diverse and includes people from these cultures. And the example you gave is excellent because it highlights the need for creativity in the way that we apply these principles. Let's say I'm sitting on an institutional review board and I'm presented with a protocol from a pharmaceutical company that's wanting to test the effectiveness of a new antidepressant. I know that placebo-controlled trials are very controversial and we'll be discussing those in another dialogue. But let's say my IRB is in principle willing to approve a study like this. What should the informed consent process look like?
One would want to be very clear with these patients from the beginning to remove the common therapeutic misconception.
And what is that?
The therapeutic misconception occurs when someone who is already in patient status, who is already receiving care, may come to believe that they will be getting treatment in all arms of the research project. So even though one tells them this is research, and one tells them there's a placebo arm where there may be a period of time where you would not be actively being treated, the patient participant may assume they're always looking out for my best interest, I'm going to be getting continuous therapy, and so forth. This is obviously a part of their decision-making process, and they can't make a good decision for themselves unless they're fully informed of that.
What other information should we provide in such a context?
The key to informed consent is giving the participant all of the information that might reasonably influence their willingness to participate. So certainly letting them know up front that this is research, letting them know the details of the research which are relevant to them, letting them know that they can choose, in the case of these patient participants, to continue receiving therapy from the institution or the practitioners that they were already involved with without penalty should they choose not to enroll in the study, making clear that enrollment is voluntary, and also making it clear that they have a right to withdraw from the experiment or from the study if it proves uncomfortable or if they have a change of heart.
So far we've discussed informed consent, but I know that sometimes ethics codes, ethicists, IRBs speak of assent and permission. Are those just synonyms for informed consent, or are they different concepts?
No, Jim, they're quite different concepts. Informed consent is a bit of a tautology since you can't really give your consent to something without full information. But we use that double term to emphasize the importance of the information. Then again, consent is something one can only give for oneself when it's necessary because of incapacity, that is to say, incapacity due to age, incapacity due to cognitive impairment or mental illness, incapacity due to medical impairment such as coma, then someone else is going to have to give consent. We refer to this process as permission giving or proxy consent, where another legally designated individual makes the participation decision for the person who is incapable legally or practically for doing it themselves.
You mentioned that age sometimes can be a reason why someone is treated as incompetent. Yet certainly the cognitive abilities required to give informed consent exist in a continuum. In certain minors, let's say a 16-year-old, might be rather mature and be able to understand the study, appreciate how it relates to him or herself, and is able to reason with that information and articulate a decision. In such cases, are they able to give informed consent?
Yes, in many cases, institutional review boards will allow mature minors to make their own decisions about participating in research independent of their parents. This would be true in areas where the research topic might be sensitive, such as history of substance abuse or sexuality. However, the IRB will weigh the potential consequences and make sure that it's a decision that the person is capable of giving for themselves.
Right. Now, with a 5 or 6-year-old, would we ever conduct a research study involving them as participants without their permission or assent?
One might. You've introduced the concept of assent, which is an important issue. Assent can apply to anyone for whom proxy consent has been granted. And in that context, assent refers to the right of the individual to decline to participate on their own volition, even though someone else has agreed to let them participate. It essentially is a veto power.
And is that universal, that we should never include someone without their assent, or are there times when we would also forego the assent?
This I'll tell you my position, which not everyone would agree with, but I am one of the people who makes a clear distinction between research with potential therapeutic benefit and research with no clear benefit to the participant. I would argue that there's an absolute right of veto power for any participant in research where there is no clear benefit to that person. They might even decide they don't want to be in the study because they don't like the look of the investigator. They have that right. On the other hand, if there is a research protocol that is potentially beneficial, for example, a study that would compare two medications, one of which the client is currently taking or the participant is currently taking, and one of which is a new medication that might be more effective. And that might be a situation in which one would not want to allow veto authority because younger children or incompetent individuals might not be fully able to weigh the risks and benefit to them.
Part of obtaining informed consent is ensuring that participation is voluntary. What are some ways that researchers perhaps fail in this regard and maybe quietly, unknowingly coerce participation?
There are lots of subtle pressures that can be placed on potential participants, even below the level of the investigator's awareness. One, for example, occurs when the investigator is also a clinician, and the person wanting to please their clinician or believing that the clinician only has their best interests at heart might be less critical in their assessment of their participation. Another circumstance, as described earlier, might be when the participant is laboring under the therapeutic misconception. Still, another example might be the situation where there is compensation being offered which is significant enough that the person is willing to put up with discomfort or embarrassment or other factors that might inhibit their participation because of the compensation.
IRBs and participants sometimes complain that researchers treat informed consent as a form that participants should read and sign. Others argue that it should really be a process, an ongoing process. What should this process look like?
I agree that the form is merely a documentation, a starting point, an outline of the points to be covered. There may well be elements of the form which are ambiguous or confusing, but the idea behind it is it's the foundation which can then begin a dialogue between the investigator and the potential participant where questions can be asked and answered back and forth.
Is it ever necessary to continue this dialogue at later points in the study and reconsent a participant?
Yes, studies can change. The protocol might be altered. It might also appear at various points in time that the participant has forgotten key elements. These might all be reasons to remind them of the conditions of participation. In addition, there may be some people whose impairment or illness under study, such as Alzheimer's disease or people with memory problems, might forget the consent. And in such cases, it might also be critical to reoffer the information.
Well, Gene, until now, we've really emphasized the fact that informed consent is a cornerstone principle and that research should not be conducted with human beings without informed consent. But like so many other areas in research ethics, we find that there are gray areas. For example, our regulations recognize certain categories of exempt research. One of these is research with existing data. For example, research with medical records in which identifiers have been removed. Another gray area is research that's based on assessment or outcome studies. And these studies are becoming increasingly common as people seek to base their practice on evidence. They want to reflect best practices. The problem is that very often these assessment studies are then published or shared publicly at conferences, and informed consent is often never obtained.
Also, in outcome studies, sometimes informed consent is coerced. When people come to a mental health provider, they are asked, as a condition of them receiving services, to sign a consent that allows the provider to really use that data to study outcomes. That's why it's called coerced consent, and I think it's an example of gaming the consent process.
Another gray area that we're going to look at in a moment through the eyes of our discussion group members is the blurring of the distinction between research and therapy, which is increasingly common in clinical research.
And I would say is much more widespread than ethicists and researchers have realized, as our discussion group will illustrate. And how many people here participated in a research project to get medicine? One, you did. You, yeah. Anybody else here?
I lost my job and I didn't have any medical insurance. And if you don't have any medical coverage, sometimes you can't. And if you're going through like a depressing situation or circumstance where you need medication and what have you, or you even need consultation, it was advised to me that, well, and they said that they would, they had programs which could provide medication if you couldn't afford it, and also provide consultation and therapeutic services, possibly free, and even for some type of compensation. So sometimes you can find out from a healthcare provider that this is an alternative for you if you don't have the finances or insurance. And so sometimes people opt, because they need some kind of a help, they opt to get into the research program in pursuit of help that they can't afford.
I think most people are real clear on trying to do that, but that it doesn't always translate. I, for one, would never do a medical drug study that they didn't provide the medication. I'll be darned if I'm going to try out a drug for them if I'm paying for it. And you may overlook that during the informed consent. It almost becomes just a word, because sometimes people are there just for the money and don't pay attention to it. And what the informed consent is, they've already made up their minds, so they tune out. I was wearing the other hat as a researcher at one time, doing the questioning, and I could see people zoning out when I was trying to do the informed consent. Their mind was focused on the compensation and getting through it.
Gene, research ethicists often speak of the therapeutic misconception, the idea being that the purpose of research is to generate new knowledge, whereas the purpose of therapy is to provide treatment for an individual patient, the best treatment possible. And as we heard in the discussion group, sometimes people enter into a research study in order to get therapy. And then they can sometimes confuse the competing aims, the aims of the participant and the aims of the researcher. And we heard that there are certain things that contribute to this confusion. For example, one participant said that his healthcare provider recommended that he entered into a research study to get free medications. But perhaps the tension here is intrinsic to clinical research. And what I mean by that is that on the one hand, we want the informed consent process to make very clear that the participant is engaging in research and not individualized therapy. On the other hand, we've also said that informed consent does not justify subjecting participants to any kind of risk imaginable, and that research should offer benefits to participants. Given that, there is this sort of intrinsic tension. We know that clinical trials can indeed offer therapy for people. They can offer a high level of care. And because of that, it just seems that it's hard to avoid this therapeutic misconception.
Yes, I think it's a real balancing act, and in order to make that balancing act work, informed consent really has to imply a robust understanding and belief in research ethics by investigators. It refers not only to signed forms, but the researcher and the research participant entering into a dialogue in which all aspects of the research is discussed, questions are answered, and then that results in the agreement of the study participant to be in the project. I think our discussion group really emphasized that exchange of information as key in research, and also offered some recommendations on how to improve the process.
Especially in medication, when medication's involved. I think if it was explained to the participant prior to the study, and not necessarily just in writing, but physically explained or read to the person so that they can understand it, what you're expected, what the guidelines are, what the ultimate goal is, and the realm to what extent you're going to have to be as far as your, what the consequences would be from taking this the side effects, so that you know going into the program what you're going to be dealing with and what the outcome is at least supposed to be, or may be, to give you a better understanding of what you're getting yourself into, I think would make going into a research project a lot mentally more acceptable or easier to deal with than just going in blind and saying, I'm going to take this pill and let's see what happens.
All of you feel like the study that you participated in was fully explained to you?
Yes.
Yes.
Were you able to ask questions and they answered your questions?
Mm-hmm.
Yes.
Did they give you a form and say, read this and sign here?
Yeah.
Yes. They explained it too.
And
They
they
explained
explained
it, they explained the side effects and everything else.
And the things they explained to you, is that what happened in the research? Was it pretty true to what they had told you was going to happen?
Yeah.
Anybody here where that wasn't the case, where you were told one thing and you were surprised it was different?
Well, it's sad on paper. If it do goes another way, it'll be you making it go another way. But it's sad on paper. All you got to do is go by the paper. That's all you got to do. And it'll be quick and simple. Because they already have it set up for you.
But sometimes you're in a situation where you've got all the information in front of you, but it's not explained to you and it's all up to your interpretation. And you're still signing for something, and in some situations you may be too embarrassed to say, okay, yeah, I guess my interpretation is correct. But what they really need to do is have somebody explain to you what you're signing in depth.
But they really want you to understand. Do you understand what you're signing before other consent?
Right, as opposed to just
Right.
having a
They
signature on file
Well,
saying
you-
we're covered because he signed.
Usually they ask you, do you understand? Do you understand? They would break it down, explain it to you to understand.
What about on say an ongoing study, if they gave you information pertaining to maybe not specific, but pertaining to other people and other results that study has provided to that point? Like at the end of some studies that maybe have you fill out a questionnaire, what did you think of the program, what did you think of the study, maybe gets a little bit of the results, so before you go into the study, you know how other people who participated feel about it, if it was a negative or a positive experience.
Well, Gene, I think that some of what we just heard really should give researchers pause. The reason being that it's clear a researcher could convey all of the information that he or she is supposed to convey and do it clearly. And a participant may still not understand the information, may feel embarrassed, may be reluctant to ask questions, or we also heard a participant may simply tune out when certain aspects of the information are being conveyed. Perhaps they're focused on the financial incentive. And I think the lesson to be learned here is that researchers need to go beyond the letter of the law to try to ensure that participants really understand the information and that their participation is truly voluntary.
While investigators need to be hypervigilant, I think that it's really the responsibility of consumers when they participate in research to be truly informed about the aims of research and the methods, and to have good understanding of studies before they agree to be part of a research project.
And really, this is the only way for the informed consent process to be more than just a form, but an ongoing dialogue.
Yes, it's through dual responsibility.